The best part of working at RMA for me is, I have to say, it's really like the personal connection that I have with my patients. Everyone comes to RMA with a little bit like of a different story. So it's always great to be able to support them in their fertility journey and also be able to be part of them accomplishing their goals. So one thing that you may not know about me is that I was actually born in Portugal. I came here when I was just a baby. I was 8 months old, but I was very much immersed into the Portuguese community. I am fluent. I know how to read and write it. And it's very helpful here at RMA because we do have like a big group of Portuguese speaking patients. And oftentimes I do get assigned as their primary nurse, especially for those that have a language barrier. Fertility in itself can be pretty overwhelming, and then when it's coupled with a language barrier, it makes it a lot more challenging. If I'm able to make them feel more comfortable and educated in the process, and they have a better overall experience here at RMA, then that's great. Typical day for me is I usually get in around 7 o'clock in the morning. It starts off with morning monitoring where I'm able to see my patients, or not just my patients, but everybody else's patients with the physicians. I usually accompany the physicians with the ultrasounds, and I'm able to kind of help patients with next steps. After their ultrasound findings are done. Once morning monitoring is over, which is usually about 8:30, 9 o'clock, I get back to my desk, get a cup of coffee because I need coffee to help me throughout my day. I'm able to then kind of connect with my patients via email or on the phone. It kind of depends on how the lab is functioning that day, but we typically get them back between, I would say, 1 and 2 in the afternoon, if not a little bit earlier. We do have to review it with the physician. So one thing that I do suggest is that really patients come to us, and before they kind of do anything on their own based off of certain readings off of the internet, that they really come to us as their primary physician and their caretaker, so we can help guide them on what the right choices may be for them.
We always want our patients to feel they have the answers that they need. We never want them to feel they're uncertain of what their next steps are. So whether it's a short journey or a long journey that we go through with our patients, we always want our patients to know, as nurses, we're always there for them. Besides being the nurse manager here, I'm also the manager of the OR. That's when patients have to come in and have their retrieval. But sometimes when it's a patient's first experience having to come through the OR, it can be a scary experience. They don't know what to expect. Our staff guides our patients from beginning to end. The doctors will come and meet with you. The anesthesiologist will come and meet with you. We practice a safe environment for our patients. And of course, if you have any questions before having to have your surgery, whether it's retrieval or surgery for something else, we always want you to ask questions from beginning to end. You will always feel cared for, safe, and well taken care of.